Good afternoon, ladies and gentlemen, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator, Jennifer Zellmer, President and CEO of CFHI. Please go ahead.
Thank you so much, and welcome everyone to today's webinar on the Priority Health Innovation Challenge and the Momentum Challenge. Delighted to have all of you on the line today, and I encourage you to use the opportunity in the chat box to introduce yourself to your fellow participants on the call. Just a reminder as well that today's webinar is being recorded so that we can share it with others after this session as well. I want to begin the webinar by acknowledging that those of us here in the CFHI offices are meeting on land that has been inhabited by Indigenous peoples since the beginning. We are broadcasting this webinar from Ottawa, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today, and also wish to recognize that webinar participants today are joining from right across the country, homelands to many Indigenous people who, and we encourage you to use the opportunity in the chat box not just to introduce yourself, but to also use that opportunity to acknowledge the First Peoples on whose traditional territories you are joining from. My name is Jennifer Zellmer, today's host and President and CEO at the Canadian Foundation for Healthcare Improvement. And we're thrilled to have participants from coast to coast to coast of Canada joining us today. As we get started, there's just a few housekeeping items that I'd like to mention. I'll introduce our speakers in a few moments, and you can, for those of you who joined just a little bit later, encourage you to join others in introducing yourself in the chat box. We're pleased to provide simultaneous interpretation and a fully bilingual chat box for this webinar. If you're currently participating in English and would prefer to hear and view the presentation in French, please let us know using the chat box and our producers would be happy to help you out. Si vous entendez maintenant l'émission en anglais et vous voulez transférer au français, veuillez écrire dans le chat box et nous vous aidera. So just a quick overview about the Canadian Foundation for Healthcare Improvement as we get started. We're a national not-for-profit organization funded by the federal government and focused on helping all those we work with to achieve more healthcare improvement that reaches more people right across Canada and that lasts. We've recently updated our strategy and refreshed it in terms of how we do this. And there's 4 primary ways that we're aiming to achieve those objectives. The first is to focus on shaping the future of healthcare, so looking at the policy and system enablers and barriers that really help to make either healthcare improvement easier or harder to achieve. The second, our emphasis, is to drive the rapid adoption of proven innovations. So to look at how can we make sure that innovations that have popped up in one place or another across the country or globally are able to benefit more and more people. And of course, our teams who are joining us today who've been participating in our quality improvement collaboratives are part of that journey with us, and we hope the rest of you will be joining us in that process as well. We also focus on enabling improvement-oriented systems, so building capacity across the country for improvement through programs like our Extra program for executive leadership training. And last but certainly not least, in some ways in fact the first, to find and promote innovators and innovations. So basically to identify those sparks of light across the country for people who are working on challenging problems, connect them with each other, and then help to raise the profile of their work. And we also hope that the challenges will help us in that regard as well. If you're interested in more information about our work, including other current opportunities to collaborate, our website is a great resource, and we encourage you to join us there. So for those of you just joining the webinar, I'm Jennifer Zellmer, and with this webinar, we hope to do a couple of things. First, we aim to introduce the really fresh, hot off the press, newly launched innovation challenges led by CFHI in collaboration with many pan-Canadian supporting organizations. The second, to learn more about the shared health priorities in improving access to home and community services and mental health and addiction services, which is a focus of the Priority Health Innovation Challenge. And we'll introduce you to some of the partners and their perspectives on these challenges as well. Third, to equip interested teams with the information they need to register and qualify for either of the two challenges. And last but certainly not least, to address your questions through an open Q&A. And please feel free, as questions occur to you, to type them into the chat box as we go, and we'll also make sure to reserve some time at the end of the webinar as well for an open dialogue. So, why are we here? Open Innovation I'm supposed to introduce presenters first. Got to get my order right. Today's presenters, I'm delighted to be joined by a fantastic group of people from various organizations and places across the country. Angela Morin is our patient partner at CFHI, joining us today from Wolfe Island. Kathleen Morris, VP of Research and Analysis at the Canadian Institute for Health Information. Sitting next to me in the webinar studio, Michelle Rodrigue, VP of Organizational Performance and Public Affairs at the Mental Health Commission of Canada. Delighted then to have Glenn Brimacombe, VP of Strategic Partnerships and Priorities at the Canadian Centre on Substance Use and Addictions, joining us, as well as Nadine Henningsen, CEO of the Canadian Home Care Association. Each of our guests today has important perspectives on the priorities for healthcare improvement that the challenges focus on, and we're really looking forward to learning from and hearing from them. So now, the part that I was skipping ahead to, why open innovation? You know, it's funny, that word innovation. It's sometimes seen as like the light bulb, the magic spark of light. And that's true. We need those brilliant ideas. But it's also about how do we convert those brilliant ideas into changes that make a difference for individuals, for their families, for healthcare providers, and for the health system as a whole. And so fundamentally, it's about the hard work of testing those ideas, sharing the results, good and bad, and making proven advances available to all those who can benefit. So like improvement collaboratives that some of you are involved with, Open Innovation Challenges engage and support teams around a specific set of improvement goals. But unlike some traditional models that define the how to achieve the desired outcome, we're counting on you, Open Innovation teams, to put forward your own creative solutions towards a common goal so that we can learn collectively from your experiences. So the two innovation challenges that we've recently launched build on a long history of open innovation. So it goes back to things like Napoleon and canned food and the space race of various types of space innovations. And so we're using this kind of approach to really do the focus on how can we advance care right across the country. And I know a number of you are eager to get started, so I'll jump into some of the details of each challenges and how to get started with registering. The first of the two challenges, the Priority Health Innovation Challenge, is open to those who want to improve access to mental health and addiction services and to home and community care. It's really designed to identify and grow promising innovations on these shared health priorities. And in this challenge, as in the Momentum Challenge, to assure a focus on outcomes that matter deeply to patients and their families, all teams must include a patient partner to guide their work. The second challenge is a by invitation Momentum Challenge. It's for teams who are working with us already in one of our quality improvement collaboratives, helping them to achieve long-term success, so to extend our journey and focus on sustainability and further spread and scale. We'll all be working with a community of innovators to deepen the reach and the impact of proven innovations. So in both cases, it's about moving the dial on health outcomes and working together to reach more people. I'm so pleased in that context because we really are focusing on patients and families and their active involvement in this process that CFHI's patient partner, Angela Morin, will be sharing her reflections on why this work is so important for patients and families in a few moments. Just before I hand it over to Angela, though, I just want to give you a couple of other quick insights into the challenges. So what's in it for you? We hope that you'll join us for a variety of reasons. First, because we hope that we'll be able to provide you with some support to reach more patients and to move the bar on health indicators that are important to all of us. We've designed this process in a flexible way that allows you to choose the extent of your participation, so which areas you want to focus on, for instance, out of the indicators, and how you want to engage in the learning and exchange opportunities. There is also both money and glory on the table for teams who are improving the care the most, reaching more people, and achieving other goals. We'll be providing teams with a series of improvement tools and bringing our partners in as well with the tools and resources that they want to share that they've developed over time and might be useful to teams as you go ahead. So that will include webinars like today's, but also other ways to connect and learn across teams. We'll be focusing as well on sharing those experiences and helping teams who've made developments, made advances, learned important lessons, share those with others, and really connect with a community of peers right across the country. We're expecting more than 100 teams to be in this challenge, maybe many more, and we're backed by a coalition of supporting organizations. So we really hope that this is your opportunity to avail of that collective expertise and experience, learning by doing, and really working with a philosophy that we believe in deeply at CFHI, which is the opportunity for everyone to teach and everyone to learn. So right now, you have the opportunity to register for the challenges, and we're heading towards, as you'll see in a minute, I'll share a sort of timeline for each of the challenges, but the first awards come up in mid-May, and those are an opportunity to identify your teams, including your patient partners, confirm the areas that you're focused on, and share with us your ideas for your plans during the course of the challenge. So with that, I want to introduce you to our supporting organizations for the challenge. The supporting organizations are a critical element of the challenge. We've got a team of organizations who are all putting their hearts, their minds, and their ideas on the table to hopefully help us, make us collectively successful at moving forward. So you'll see that we have many pan-Canadian organizations who are participating already, and we're also talking to a few more who may join us as well. So you see on the screen the logos of those who have agreed to join us in this journey, and as you heard when I introduced the speakers, a number will be sharing their initial thoughts with us today. Central to the challenge and to the work and improvement, a proven opportunity for us to be effective and to really make a difference is active involvement of patients and families. And so we wanted to start our conversation today by turning things over to Angela Moran, who's going to share her thoughts on why this work matters to patients and families. So Angela, over to you.
Wonderful. Thank you so much, Jennifer. It's so exciting to hear about all of this, and I just want to acknowledge that I'm actually on Wolfe Island, Ontario, which is in the Kingston area, the traditional territory of the Huron-Wendat and Iroquois peoples, and I'm really happy to be here with you today. As you have noticed probably since with Jennifer's introduction, patients, families, and caregivers are identified as partners in CFHI's strategic plan. We know that working with people with lived experience leads to new insights and better results than when providers and leaders work on their own. CFHI is modeling and championing meaningful engagements with people with lived experience to build our capacity to co-design healthcare improvements and ensure meaningful engagement in driving innovation across the spectrum of healthcare in Canada. So I am really excited to reiterate that the Priority Health Innovation and Momentum Challenges are reinforcing the importance of engaging patients and families in quality improvement by requiring the inclusion of a patient and or family caregiver who has experienced care and or who needs care on the challenges teams. Like many of you, these shared priority areas for the Priority Health Innovation Challenge in particular of mental health and addiction services and home and community care have touched my life and the lives of my friends and family in many ways. I've experienced the sense of fear and anxiety of being at home with a newly discharged post-op patient, of arriving home with no support and no supplies, the concern that we might do something wrong, the distress of waiting day after day after day to hear from home care, the frustration of having to finally call on the fourth day, which was a Sunday, to ask when they are coming or should we go to the emergency department, and then the astonishment of being told after those 4 days that there was no referral in the system, that there were no nurses available, and having to take him to them. And I questioned, how is this home care? I had the same question when my friend arrived home with her son, directly discharged from ICU, to find a box of supplies sitting on her front step with a note asking them to come in to see them if they needed help with the IV. How is this home care? I think about all of the people I know who have cared for a loved one through difficult times, who are dependent on support day after day, and the energy it must take to navigate that. And I think of those who needed the support and never found it. But I also think about the home care my mom received and my friend Bonnie received during their cancer journeys, and what a positive experience that was, of how we were partners in their care. We were on the same team, and we felt safe, and we felt respected, and we were cared for. I also think about all the great, dedicated, hardworking individuals who are working in healthcare trying to make it better, that could use some support and guidance to bring their ideas to life and to reach more patients. I am really hoping as we launch these challenges that are focused on identifying and growing promising innovations, that the teams will hear, share, and learn from the stories and experiences of the people who will be impacted by the change, that they will ground the work in improving access to things like mental health and addictions and home and community care services in why it is important to patients and families. We need to ask patients and families, and that they will be partnering with them in collectively working together to move the dial on indicators that are really so important to patients, like improving wait times for community mental health services and referral and self-referral services, or early identification for early intervention in youth, or home care services that really help the recipients stay at home, and addressing what is becoming a very huge growing problem for caregivers and distress. For patients and families, their healthcare experiences do not happen in silos. They live them in hospitals, clinics, on the streets, and at home. They need a healthcare system that responds to that reality. They need organizations, providers, and systems to be working with them toward the common goal of improving the patient experience. These challenges are about wanting to support innovators to make that change happen. We are better together, and I am so excited to see what we can do together. Thanks very much for being on the call. Back to you, Jennifer.
Thanks so much, Angela, and thank you for sharing your perspectives and your experiences. And I know from just reading the chat box and from my own life that as you were speaking, a number of the examples that you raised, they're things that we experience in many different parts of the country. And, they're challenges that I think they are those things that get us up in the morning to try and be able to improve care, to make sure that that balance tips towards those great experiences that you described and away from the ones that are challenging. So thank you so much for sharing your perspectives. And we hope that, Angela, you'll continue to, and that many other patient partners will join teams in this journey. And I just want to take a couple of minutes to talk about each of the challenges in a little bit more detail. So the first is a Priority Health Innovation Challenge. It's open to teams right across the country with a focus on outcomes. It'll run for 18 months from April this year to October of 2020. And there's rolling enrollment, but obviously the sooner you're in, the more opportunity you have to make changes happen and also to qualify for the various awards that are part of the challenge. Teams have the opportunity to track progress on one or more of 12 indicators and shared health priorities and by how many people are reached. There are both monetary and non-monetary awards, and those will be shared among teams based on a series of milestone awards through the course of the challenge. So the first one has a deadline in mid-May, and it's a focus on identifying your team, including your patient partner, the area that you're focusing on, and putting together a short video of up to 3 minutes. Now, there's not cinematography points on this, so the whole objective here is just to be able to describe your intention of what are you going to try and do through the course of this challenge. And judges will pick the top 10, and each of those get $1,000 to kickstart their work. And that's part of the overall series of awards of up to $400,000 that will be awarded through the course of the Priority Health Innovation Challenge. The participation is flexible, meaning teams can participate in the award opportunities as you wish. So you can apply for the first one, for example, or if you don't quite make it to apply for the first one, although we hope since you're on the webinar today you will, you can still qualify for later awards. There'll be quarterly webinars available to teams in subject areas relevant to these 12 indicators, as well as to the fundamentals and foundations of quality improvement. There's an opportunity through the course of the challenge to connect with a community of innovators right across the country and our coalition of supporting organizations. So we really hope and help that you'll be able to do that. So just to give you a quick sense of the areas that we're focusing on, these are indicators that were identified by federal, provincial, territorial governments through a process that occurred right across the country. And there are 6 that are focused on mental health and addiction services. You see them here on your screen. Many of them are focused on better supporting care closer to home and access to community mental health services. Some of them also, of course, touch the hospital sector as well. And we were fortunate to be able to see the results of the poll for those of you who were on a little bit before the webinar started, and great to see that there are teams who are interested in each of these areas already on the webinar today. There are also 6 indicators related to home and community care, everything from wait times for home care services and referral to services, some of the issues that Angela spoke about, but also about the really important issues in terms of things like the ability of home care services to help you to stay in the setting of your choice, if that choice is at home, the ability to support caregivers, whether it's friends or family or others in the community, to support people who need that help, and avoiding inappropriate moves to long-term care and being able to support people to die in the setting of their choice. So it's those kinds of measures on the home and community care side, and again, it was great to be able to see that there are people on the call interested in each of these areas already. This just gives you a snapshot of the timeline as the challenge folds out over the next 18 months. As I mentioned, the Early Innovator Award deadline is coming up in May. And then you'll see that there's a series of both supports and challenge awards through the course of the challenge. And we hope that you'll join with us throughout the process and be able to share your experiences along the way. The second challenge is the Momentum Challenge. So the Momentum Challenge is open to teams that have worked with CFGI in the recent past or actually are still working with us for the last part of their Quality Improvement Collaborative. So specifically for the Inspired COPD Scale Collaborative, the Connected Medicine Collaborative, which focuses on e-consultations between primary care and specialists, and the New Brunswick Appropriate Use of Antipsychotics Collaborative, which focuses on person-centered care for those with dementia in long-term care. Each of these teams through the course of the collaborative has broken important ground in areas right across this spectrum: community care for people with chronic diseases, helping multidisciplinary teams of healthcare providers use data to drive improvement more effectively, for instance. And we're hoping that the challenge will help these teams move towards even longer-term success by working with their colleagues, both within the community that they've already been involved with their improvement collaborative, but also across collaboratives over the next 12 months to expand their proven innovations to reach more people who can benefit. Teams will continue to track their progress on a subset of indicators tailored to their program stream, as well as on how many people they reach. And again, both monetary and non-monetary award opportunities will be made available, as well as quarterly webinars that focus on that sustain, spread, and scale set of priorities for teams. These teams, too, will become part of our community of innovators by joining the challenge and having the flexibility to take advantage of the program offerings as you wish. Here's a quick snapshot of the timeline for the Momentum Challenge, and you can see that the timeline is a bit different because this is a 12-month challenge versus 18, but we will have a series also of content-based webinars, program opportunities, and awards that occur over the course of the challenge, and we hope that will help to support you in moving forward. So with that quick snapshot across the two different challenges, we've got an opportunity now to move to the process for so you're ready, so you've decided to go, what do you have to do? The official terms and conditions, all that fun stuff, is available on our website at the site that you see on your screen. There is a two-step process to sign up. The first is short and sweet, just to register your team, and then the second is to submit qualifying materials to complete your application. So for instance, identifying your patient partner, identifying the specific area you'll be working in if you're working with the Priority Health Innovation Challenge. And by May 10th for Priority Health or May 23rd for Momentum, you have an opportunity to submit a video to introduce your team and describe your initiative to be eligible for the first awards. And I encourage you to review the information that's available on the website for a little more guidance in terms of those awards. I should have also said, which I forgot, if you're wanting to participate in the Momentum Challenge, that one does actually have an enrollment date. So we need you to sign up by May 23rd so we can make sure that we work with you throughout that 12-month period. So that's how to get started, quick and easy, and just visiting the website to get going. And we've got a couple questions in already, so I'll start with those questions. And then if you have further questions, please feel free at any point to type them into the chat box. We can take a couple now, and then we've also got time reserved at the end after we've had a chance to hear from more of our partners. So the first question that came in was from InstaHeal and looked at the opportunity for reaching right across the country and how do we support teams in doing that. So first of all, it's important to say that the challenge is open to teams who are participating right across the country, and you have the opportunity to create teams that could be either in one site or multiple sites. So we recognize that you may wish to grow a broader team that brings in friends and family who are interested in taking a similar approach to you. So you're able to build out that broader team across the board, and teams may indeed choose to use a technology solution as an important part of their initiative, or they may choose to use other types of process improvement approaches or changes in models of care. That's one of the things we hope to learn through the course of the challenge, is what types of innovations are teams picking up, and what are you interested in having a look at. Teams need to have a team leader, so we've got somebody to communicate with, and if you're successful in receiving an award, we know who to send the check to. You also need to have a patient partner at a minimum, and you need to have confirmed a senior leadership participant from your site to make sure that you've got the ability to sign up as part of the challenge. Your senior leadership member could be your team leader as well, but we need to make sure that you've got those roles on your team. Other than that, you can have as many team members as you like and as will be effective for you in moving your initiative forward. And I'll just do one other quick question and then we'll move on to hearing from our partners. In terms of what's expected from participants in May, the requirements are a little different for the Priority Health Innovation Challenge and the Momentum Challenge because teams are at different stages. So in Priority Health, you can be just starting out, whereas the teams participating in the Momentum Challenge have been working with us in a quality improvement collaborative over the last little while. So I encourage you to actually go to your website and have a look, go to our website and have a look at the detailed requirements for each challenge. But the intent is in May that you're not providing us with a ton of data. The intent in May is that we're getting started, and then data will be provided over the course of the challenge. If you have detailed questions as well after you've had a look at the website, don't hesitate to contact us, and we'd be happy to address any of them as well. So with that, please continue, if you've got other questions, to include them in the chat box, and we'll go on. But some of those questions may actually be answered by our next few speakers. And I now want to turn over to Kathleen Morris, who's Vice President of Research Analysis at the Canadian Institute for Health Information, because they have had a central role with these indicators and the shared health priorities. So Kathleen, over to you.
Thanks very much, Jennifer. So in addition to my role at CIHI, I was also the chair of the CIHI FPT work groups that actually chose the indicators and are now working to develop them. So I thought it would be helpful for me to give everyone a bit of a peek at how we ended up with these particular indicators and how they'll be rolled out over the next couple of years. So the whole piece started about a year and a half ago in the fall of 2017 when the health ministers from across the country agreed to some common priorities, all about improving access to mental health and addiction services and to home and community care. And the charge was for governments to work in concert with CIHI to develop a focused set of common indicators so that we could measure progress. And the couple of slides here sort of outline some of the more specific information for home and community care. And on the next slide, if we could go ahead, for mental health and addictions. And those are there more just for your reference, but there's some interesting pieces that I'll talk about as we go through the deck. If we move ahead one slide, back one, there's a slide that shows the process. There we go. And I think it's interesting for you folks to know that while we only had 6 months to get the indicators selected, we were able to pack a lot of rigor into that selection process. So if you look at the first step, it was really around environmental scans, and those were done to understand where we were starting from and what there was in terms of measurement and data availability. And what won't probably surprise many of you is that there's a lot of variation across the country. And even where some of the priorities were the same, the approaches to measuring them varied. So they used different data sources, different methods, focused on different subpopulations. So I think the environmental scans showed that we really had our work cut out for us. The second step involved getting people who were very knowledgeable to help us out. So along with the government reps, we brought in sector stakeholders, measurement experts, and people with lived experience. And really the help they gave us was there were so many different ways that you can think about the word access, and it was really good to understand the different viewpoints on that. So we had over 40 people in each sector spend a whole day together. And they helped us go from a long list. So we had, in each of the 2 areas, we had come up with almost 300 different possible indicators of access, and they were able to help us narrow down to a short list, and I say that in quotes, of 100 indicators in each sector. So that was really very helpful. What we did after the meetings had wound up and we were down to our 100 indicators is we asked these same people to stay involved with the process and to do a really detailed assessment of each of the indicators on the short list. So they had quite a bit of homework, and while they were busy with that, we did some other consultations with the public and with people with lived experience, and we were really trying to understand what did access to services really mean to them, and what in their minds would meaningful measures of access look like. So we had 2 streams coming together, one quite structured and analytic, and the other bringing viewpoints together, and I think it gave us a really rich base to work from. Step 4 in this diagram was the actual selection, where the work group members used the results of both the outreach and the analysis to come to a consensus. And some of the things that that group thought of was, I think that informed their decisions, is certainly they went back to the charge that they were given from their health ministers, and they focused on some of the words that you saw earlier in the deck in the specific items. So they thought about caregivers, they thought about palliative and end of life. In mental health, they were quite conscious of the fact that it was mental health and addiction, so some of them were really focused on substance use. They looked at kids, early intervention, integrated systems, and suicide. And certainly from some of the public focus groups, they knew that it would be hard to measure access if wait times were at least a subcomponent of it. I think that the people in the room were super, they're obviously there to represent the needs of their province and territories, but they were really very, I think, moved by the input of the public and people with lived experience. And they were very committed to looking at measures that would be good for all Canadians. So I think that was certainly to their huge credit. They were asked by their ministers to come up with at least 6 indicators, and they actually landed on 12. And they were very focused on having new indicators so that they had better information on access to these 2 very important sectors on which to base their improvement. So with all of this done and the selection of, or the proposal of 12 indicators, it went through quite a few steps after that in terms of official approval. So it went first to the Conference of Deputy Ministers meeting, and from there to the health ministers, and was finally approved in July of 2018. So right now, we're at step 6, which represents a huge body of work in terms of the development of these indicators, and that's something that will happen in stages. And if we flip to the slide with the 4 post-it notes, you'll see the sequencing of the indicators. I think it's good to know that each of the indicators has its own process and has lots of independent expert advice going into it. But the FPT work group continues to be there and play a core role. And it's been expanded somewhat to include Statistics Canada, who will handle at least one of the indicators. And the 3 organizations that are on the presentation list after me, the Mental Health Commission of Canada, the Canadian Council on Substance Abuse, and the Canadian Home Care Association. So the indicator names that you see on this slide, which we fondly call our post-it note slide, are the 12 indicators, and they've been given plain English names, and plain French names as well, and that's all based on testing with the public, because really the mandate for this is to inform the system, but also to be able to report back to the public. So I'll just speak very briefly about the first 3 indicators that are coming out in May of 2019. So the 2 of them are in the mental health and addictions category. The first one there is really one that provides an indication about whether Canadians are getting access to the information that they need and the help that they need to prevent or manage harmful substance abuse. And that includes prescription drugs, legal and illegal drugs, as well as alcohol. This next mental health and addiction indicator is around frequent visits to the emergency department and urgent care centers. And that was selected because that was seen as a sign that people may not be getting the services that they need in the community. There's also one home and community care indicator, and this one was based on the fact that wait times are important to the Canadian public and to system managers. And the 2019 indicator for home and community care looks at wait times for those who are waiting to be discharged from hospital to home care. And sort of another look at wait times will happen later in 2021, where we'll report on wait times for those who are living at home and need services. So if we flip to the next slide, this kind of, we've given a lot of background on how the indicators came to be. As I mentioned, the first of these will be released in May of this year, on May 30th. And each year, we'll continue to add 3 new indicators, so that by 2022, all 12 indicators will be reported annually. There's 2 ways in which this information will come out. One of them is through an interactive web tool, and that one's really focused on a general public audience. It'll show the indicator results, and it'll have a few easy-to-understand infographics to give some richness to the findings. There's another product, which we call our companion report, and that one's really focused on those who are in the system, governments, health service providers, as well as anyone who really just wants to get into the indicator a bit more and understand it in more detail. And so the kinds of information that would be in that report include the data sources, availability, definitions, some advice on interpretations, what you can and probably shouldn't do with the indicator, and a little bit more detail on the findings. So we're very much looking forward to getting the first of these indicators out on May the 30th, and we're just, again, to reassure everyone, we're hard at work on all the others, and look forward to progressing all of those according to our schedule. So with that, I'll flip things back to you, Jennifer.
Thanks so much, Kathleen. Really appreciate that and appreciate all of the work that you're doing. And I think if we go to the next slide, there we go, we'll be making the transition. But as we make the transition, just wanted to mention to folks that obviously the indicator's out in May. You'll have the opportunity hopefully to take advantage of that good work immediately. And in the other indicator areas, you can still obviously participate in the challenge. We'll be asking you to define and tell us how you're defining the measure that you're using in that specific area, and that will be a source of input for all of us collectively to learn how those indicators are currently being measured and how we can help to track them. And speaking of indicators, half of them relate to mental health and addictions, and Michelle is sitting next to me, so I'm going to turn over to you, Michelle.
Thank you, Jennifer. So we've tried to identify a few areas that could move the markers towards mental health and wellness for all, which is MHCC's vision. We've tried to tie them to the actual indicators, so I'll start with the wait time for community mental health services. One area to improve services would be to strengthen the community, the continuum of community-based services. This could include exploring additional application of step care approach, giving the right level of service to individuals where and when they need them, developing, again, the growing body of e-mental health, which could constitute apps, web-based programming. Also, the whole area of machine intelligence, artificial intelligence, which brings a lot of promise to accelerate the offering of services or even to offer services. Regarding people living with serious mental illness, there's a need to continue to innovate, to bring new approaches to better meet their needs and to better support their caregivers and their families. There's also a need to better integrate with primary care. Collaborative care and good, strong collaborative care would be a good way to go. And lastly, in this area, we need to respond to the diverse makeup of Canada. So promote cultural safe applications, as well as services provided appropriately for immigrant, racialized, ethnocultural, and refugee populations. In terms of dealing with early identification and intervention for those individuals between 10 and 25, integrated youth services are a great innovation. A lot of provinces and territories are doing great work, and I think there's still a lot of innovation that could take place within this field. Certainly in terms of improving the transitions between that difficult period where you're a teenager and you move into adulthood, that's where the system sometimes has hiccups, and we need to address that. Of course, e-mental health is a great way to reach that age group. And lastly, they are often very accessible in post-secondary. It's the time when they are for the very first time away from home. So a lot of first instances of mental illness is developed within that time frame. As well, suicide is the second highest cause of death for kids after car accidents. So I think there's a lot of room to innovate within this field. How to navigate the mental health system? Again, e-mental health approaches could be solutions. Step care, you're getting the right system, the right support where and when you need them. Collaborative care approaches, as we've mentioned, and involving caregivers and supporting caregivers. On repeat emergency department visits, perhaps exploring innovation around brief psychotherapies that could be offered right on the spot so you can direct people. Step care, again, collaborative care, and community services for seniors, which could be linked to home care. Regarding hospital visits for substance use, there's really a need to de-silo that whole area of support. So integrating community-based mental health and addiction services, as well as focusing on harm reduction. Lastly, on the self-injury suicide rate indicator, exploring innovation around community-based approaches to suicide prevention. We know from previous studies suicide is preventable. Communities can play an enormous role. As well as providing innovative supports and tools for healthcare providers. Healthcare providers have told us they're often uncomfortable to address this issue with their patient, and they need support in terms of what do you do if someone self-discloses. So quickly, those are some of the potential areas of innovation that could address some of the indicators of shared priorities. Thank you.
Thank you so much, Michelle. And if you've got questions for Kathleen, Michelle, Angela, or any of our other speakers, please at any point feel free to type them into the chat box. And we've got some time reserved at the end for following up. We want to continue the conversation, though, turning next to Glenn Brimacombe at the Canadian Centre for Substance Use and Addiction. Glenn, over to you.
Thank you, Jennifer, and good afternoon, everyone. It's a pleasure to be here, and before I get into my formal remarks, Jennifer, I do want to compliment CFHI staff not only for organizing the event, but for photoshopping my photo. I don't think I've looked that good or this good in 10 years.
We do our best for you, Glenn.
Thanks very much. So like others, the Canadian Centre on Substance Use and Addiction is delighted to be here and to be a partner to CFHI's Innovation Challenges. And as has been alluded to, Canada in many ways is known as the land of 1,000 pilot projects, where a number of different time-limited projects have been initiated, but little has been done to recognize the scale and spread of proven and in many cases promising pockets of excellence in terms of their programs or services across provincial and territorial boundaries. And I draw on my own experience when I think of some of the efforts that have been attempted through the years, and two come to mind when I think of the Council of the Federation's Healthcare Innovation Working Group report From Innovation to Action in 2013. I also think of the Naylor report, for lack of a better term, when it comes to unleashing innovation in 2015, and both of them thematically talk about the essentialness about harnessing the power of spread, scale, how we introduce and manage change in a far more effective way. So in my mind, when I think about this initiative, building on two other important provincial, territorial, and to some degree federal as well, it really becomes essential that we do more to thread the needle of innovation across Canada. And clearly CCSA embraces the opportunity to work with CFHI and many other partners that are on the line today and supporting it. As much as we focus on the theme of innovation, it's essential that we do think about the importance of sustainable change management strategies. In my mind, that is the flip side of the same coin of innovation. And it's absolutely crucial. It is the foundation for changing the way in which we organize, fund, and deliver and manage the provision of health services in this country. Now, just speaking more specifically to my one slide that talks about the opportunities to move the mark on access indicators related to substance use and addiction, my first point I know is a cliche, but it goes without saying that you can't manage what you can't monitor or measure. And in the context of mental health and on the substance use side, it's absolutely crucial, as Kathleen Morris spoke to, in terms of the process to which we're very supportive, and some of the issues that Michelle has acknowledged with regard to identifying and indicator development around issues with regard to mental health and addictions on the integration and collaboration spectrum. You know, in some ways our sector isn't as mature as some of the others, and I think of the acute care side of the equation, so we obviously welcome the opportunity to develop more robust and comprehensive set of national indicators in the area of substance use and addiction. Generally speaking, issues of access are a significant issue as it relates to substance use and addiction. And just as an example, I think of three particular areas when it comes to access, and I can think of the issue of harm reduction services, access to family physicians and other primary care providers, and access to more specialized inpatient treatment services. You know, the at the coalface experience tells us, when we speak to persons with lived experience or living experience, as well as regional health authorities and provincial and territorial governments, issues of delayed access are very real, with very real implications. And while there are horizontal issues and challenges about how we can improve access to services at each level that I've just spoken to, there are also other issues that relate to how we can integrate care across each level. And this is what I would refer to as vertical integration. And it's conceptually akin to the notion of IDS, or integrated delivery systems. So if we want a clear and, in a sense, a more holistic picture of access indicators, I think, and CCSA thinks, we need to consider the bigger picture and its overall connectedness. And this is where we've been recently working very closely with the Mental Health Commission of Canada, and we've held a workshop last month to discuss the importance of developing a comprehensive pan-Canadian framework for performance measurement in mental health, substance use, and addiction that can assist in identifying a broader array of performance indicators that not only inform issues of access to care, but overall sectoral importance. And just mentioning that process, it is important to note that it is just beginning, and we are in the process of identifying our next steps. So there'll be more to report back in the next few weeks. I don't think I need to say too much about sustainable funding, other than it is a critical success element to facilitate and embed change. It is not an end to a means, it is clearly a means to an end, but absolutely essential. My final point refers to the difference between decision-based evidence-making and evidence-based or evaluation-based decision-making. There is a difference, and this not only speaks to CCSA's role as a knowledge broker, but as well as a research and learning-based organization in terms of the work that we do. The importance of following the evidence, as CSI would say, is absolutely crucial when it comes to effective decision-making. And as I have said for many years, research is the oxygen of an evidence-based system. So in closing, CCSA is delighted to be a partner to the process and looks forward to the many submissions that will come forward. And I should mention, just as a bit of a sidebar, when it comes to innovation, some of you will know that we have our biennial conference later this year, Issues of Substance, held in November in Ottawa. And clearly one of the important, if not dominant themes, is looking at the interplay between innovation, access, and quality. So hopefully we'll have an opportunity to see many of you there. Thanks again, Jennifer, for having us as a partner.
Thanks so much, Glenn, for joining us and for sharing your ideas today to get us started. And we started with Angela's comments and some comments and her experiences focused around home care. And Nadine, you're going to close that loop now. So I'm delighted to turn over to Nadine Henningsen, CEO of the Canadian Home Care Association. Over to you.
Thank you so much, Jennifer, and I'll do my best to try to close that great loop that Angela certainly began. I will begin by, I guess, reiterating Glenn's comments and saying that the Canadian Home Care Association is very excited to be involved and engaged in this project. Certainly one of the things that we find as a national association when we talk to stakeholders right across the country, we hear challenges, but we hear so many promising practices that are happening, and we really believe that this innovation initiative will really stimulate collaboration and really accelerate opportunities in home care. And I just want to say it's great to see so many colleagues and various organizations participating on this information call today. So as Kathleen mentioned, she provided an overview of the work that CIHI is doing on the national indicators. What I'd like to do is maybe peel the layers back a little bit and build on this to share some common challenges and gaps that would be absolutely fantastic if they were to be identified and addressed or explored through this innovation challenge. So we really believe that identifying and sharing these promising practices in the areas that I'm going to present to you this afternoon will really support the achievement of the outcomes that CIHI is working so diligently on to be able to measure and report on, and certainly as those national indicators roll out. So this slide here really kind of reiterates one of the slides that Kathleen had presented is the shared health priorities and the goals of the shared health priorities. And this really is our touchstone in home and community care. We know that this shapes the bilateral agreements that I think the last one has just currently been signed with the federal government and the Manitoba government, so congratulations on that. But it's really shaping, and we know this, the strategies and the funding and the direction that home and community care is taking across the country. And you'll see that within these shared health priorities, there's 4 key areas that are really, can I say, key planks in where all the provinces and territories are going. So I'm going to delve a little bit into showing you some of the challenges that we know within each one of these key areas, and hopefully we'll be able to, as we collaborate throughout this innovation challenge, identify some promising practices to address these gaps. So I'll have you turn to the next slide, please. So this is certainly not an exhaustive list, but I will share that a number of different projects that we've worked with colleagues. I see some of them on the call today, the Canadian Medical Association and the College of Family Physicians of Canada, really looking at the challenge of how do we integrate and connect home care and primary health care. And if you take that as a big goal, when you really look at it, some of the common challenges that are being experienced across the country, and I hope these are resonating with the participants on the call, is linkages. How do we align, or how do we ensure that systems are available so that home care case managers or care coordinators are linked and working with primary health care teams, that there's communication mechanisms and they know who each other are and they're doing shared decision making together. So that's a real area that if we could pop up some innovations, it would be absolutely huge to move that marker. One of the things, and I'm noticing the chat box, we have a colleague here that's, I believe, from out in BC that is working on chronic disease management. And one of the things that we found with really looking at integrating home care and primary health care is how do we include home care and that self-management and that early identification in chronic disease management strategies and different clinical pathways. So looking for innovations around that would be wonderful. And then last but not least, for this one, really with the heart of integration and connection is partnerships. So, who and how are our different jurisdictions or organizations working team-based care models? And one we're quite excited about is the refresh of the Patient's Medical Home that has just been launched by the College of Family Physicians of Canada. And we know that it's had some great uptake in different jurisdictions. And where is that movement on the Patient's Medical Home engaging and really connecting to home home care. So if we were to identify some innovations around these three areas for this first priority of integrating home care and primary health care, we see huge benefits for the system, for the providers, for the patients, and for the caregivers. So I'll have you just turn to our next challenge slide. This one really looks at a home-based palliative care, and we were very fortunate in that we're, as a national association, we're actually in year 2 of a Health Canada-funded project looking at gaps and challenges in home-based palliative care. And we just came off a national consultation to really identify what are some of the real key gaps that are resonating across the country, and hopefully we'll find some innovations through this initiative. And these 3 gaps, so the first one is really looking at communication. What kind of strategies are being used or developed or have been successful in really engaging the broad healthcare team to help an individual choose to die at home? And Angela, building on your very poignant comments at the beginning of the session, the patients and the caregivers have absolutely critical voice and need to be engaged in that team. But also looking at communication strategies with new members of the team, like paramedics that we know are now being involved, or looking at communication across different care settings, because we recognize that sometimes a patient has to change from, let's say, move from a home setting into a hospice setting or into a long-term care setting when they've been diagnosed as palliative. So how can we really find innovations to support that communication? The second one around advanced care planning, this one's really exciting for us. And we know that there's lots of great things happening to encourage Canadians to write an advanced care plan. But what we're looking for your help and through CFHI's Innovation Challenge is to say, is there any innovations or leading practices out there that are really engaging individuals not only to actually document and share their advanced care plans, but have the service providers actually use those care wishes and embed them in the care planning and delivery. And really it's fundamental to shared decision making, and how do they use these advanced care plan wishes as the core to shared decision making. So we're really excited to see what's out there through this Innovation Challenge. And then certainly last but not least on the home-based palliative care is a real big challenge that we identified, which was a little surprising for us, is medication and supplies. And it went beyond just accessing the appropriate medication and supplies, but how are medication and supplies managed efficiently in the home so that things don't get lost or misplaced. And one of the real areas that we found, certainly talking to patients or certainly talking to caregivers after their loved one has passed, how do you dispose of medications and supplies? Is there any innovations that are happening right now, or is there any really neat ideas right now across the country to help these caregivers really dispose of these very powerful and toxic medications after their loved one has passed and the medications are still in the home? So 3 key areas here. Hopefully spark some ideas on the phone from organizations that might be doing some innovations in home-based palliative care. So I'll just have you flip to the next slide. And the priority there is caregiver supports. And I think I certainly won't reiterate the importance of caregivers, because I believe everyone on this call knows of the importance of caregivers. But really, if we can look at a nutshell of 3 key areas that we find real major gaps, certainly from home and community care, is the recognition of caregivers. And it starts with an assessment, recognizing that a caregiver is part of the care team, but also recognizing that they have unique needs, and then going even further than that and saying, what is their expertise that they can bring as a partner in care? So it's that understanding, recognition of needs, but also really leveraging and accessing their expertise. As Angela said, their caregivers know an awful lot, and if we could tap into them, we would really see some fantastic successes for the system and also for patient outcomes. One of the things that we need to make sure is if we do tap into caregivers and we expect them to do a lot of the heavy lifting in home and community care, how do we support their health and well-being? Is there any really interesting respite programs that are out there that are flexible in meeting the unique needs of caregivers? Or is there any way that we're connecting caregivers, either through support groups or through technology, I know is being used in some really neat ways across the country? And then certainly last but not least, when we talk to caregivers across the country, we know that one of the key gaps that they feel is if I'd only had the correct information. So how do we build systems to access information? And how do we build systems and information so that when caregivers do get the information, they know what to do with that information? And then we build the community capacity. Michael mentioned in his key challenges a lot about building community capacity. And Michael, we certainly feel that too in home and community care. And so my last slide of challenges that I'm hoping that we'll find some innovations for, if I could just get you to flip to the last slide, is this one is quite interesting because it underpins the first three areas that I just mentioned, and that's really the digital connectivity and potential remote monitoring. So how do we leverage technology to really be an enabler to help achieve the outcomes that CIHI is working so diligently to build indicators, measure, and report on? And the three areas that we really find challenging in home and community care right across the country is awareness of technology. How do providers or organizations know what's new or what's emerging, and how do they evaluate technology before they make key investments and spread and scale? And it's interesting because Glenn mentioned about we're a country of pilot projects. So how do we really do some really rigorous evaluation of technology so that we can move it out of those pilot stages? How do we scale technology? Are there any interesting strategies or evaluation frameworks that are being used right now to really scale and spread the technology? And certainly last but not least, and Glenn mentioned this too, is how do we ensure that technology is sustainable so that it doesn't just become a one-time opportunity for a small base of patients and caregivers in home and community care, but then also how do we make sure that the technology we're introducing is actually useful for the patient and user-friendly for the patient and caregiver. So that's all around the sustainability challenge. So I hope I've been able to spark some of your imagination. Jennifer, I will say that once again, the Canadian Home Care Association is very excited to be involved in this project. And I will mention to everyone that one of the things we asked CFHI if we could do is the innovations that don't go through to the actual funding through the challenge. We'd love to learn about them, and as a national association, work with different stakeholders to profile and share all the innovations that come in through this great work. So back to you, Jennifer.
Thanks so much, Nadine, and thanks to all of our guests and partners on the call today for hopefully sparking a bunch of amazing ideas about what some of the opportunities are for improving care in these areas. And like Nadine said, we want to learn from everyone in terms of the approaches that are being taken. We've got a few minutes for questions, so I'm going to start answering those that have already come in. If you have additional questions, you can pop them into the chat box. And Bill is also going to be popping in an email address that you can email for any follow-up questions. So the first question that came in was from Katerina in terms of whether if you're in an existing quality improvement collaborative with CFHI, you can still participate in the challenge, and the answer is absolutely yes. So we want to learn from your experiences, and we want to include you in. The only caveat on that is we are not allowed to send any money back to the federal government. So if you happen to be, if anyone from the Department of National Defense is listening on the line, because we've got some teams from a couple of federal government departments involved in collaboratives, we want to learn from your experiences, but you can't get cash, just glory. Other questions that came through, the indicator for awareness and successful navigation of mental health and addiction services is specific to mental health and addiction services, but given what you typed in the chat box about the focus of your work in terms of integrating chronic disease management from acute care to the home, you might want to look at the indicators under home and community care relating to the alternate level of care, length of stay for inpatients requiring home care, or the wait times for home care services and referral to services. Depending on what you're doing, those ones may be relevant, and you may want to follow up on that front. And of course, as you're participating in RACE, we also hope that you'll participate in the Momentum Challenge for teams that are currently working with us as part of Connected Medicine. The one thing I should say on that front is you can't count the same patient twice. under two categories of the challenge. So a couple other quick questions. The methodology and guidelines for the indicators. I'll let Kathleen talk in a minute about how CIHI is planning to share the information in May and for the subsequent indicators as they come out. Certainly there is already some information in the information for teams about the indicators that we're looking at as part of the challenge. And primarily we will be looking at changes over time. So we're looking for consistency for teams in their measurement approach across time. And then what we'll be comparing across teams is primarily how that's changed. So that should be a little more stable and require a little less focused comparison across. But Kathleen, was there anything you wanted to say about how you're planning on sharing information in May and beyond?
So the companion report will outline sort of in a single page the general premise of measurement for each of the indicators, and it will explain the data sources, the definitions, the inclusions and exclusions for each indicator, along with a little bit of the rationale. So if you want just the top line, that's the place to go. If you want additional information, we love people who want additional information, so just send an email to sharedhealthpriorities@kihi.ca. That's sharedhealthpriorities@kihi.ca. And if you just explain the specifics that you're looking for, we're more than happy to get those shared.
Excellent. Thanks so much, Kathleen. So there was a question about the age for early identification. So the early identification for early intervention is specific to youth, age 10 to 25. But if you're dealing with a different age group, you may want to consider some of the other indicators like the awareness and successful navigation of mental health and addiction services, or the wait time for community mental health services and the referral or self-referral to services. Depending on exactly the nature of your intervention, those ones may be quite applicable as well. And the momentum challenge. So we did talk a little bit about the momentum challenge along the way, but let me say a couple more words about it now. So the momentum challenge is for teams who are either just finished or just coming to the end of participation in one of three of CFHI's quality improvement collaboratives. So the COPD Inspired Scale Collaborative, the Connected Medicine Collaborative, or the New Brunswick Appropriate Use of Antipsychotics Collaborative. So we invite you to join with us as part of a 12-month challenge. And for momentum teams, we'll be looking both at the number of individuals who you're reaching, using very similar measures to what you've been tracking as part of the ongoing Quality Improvement Collaborative, as well as a subset of the measures that you've been tracking all the way along. Obviously, more than welcome. In fact, we encourage you to continue tracking the broader range of measures, but for the challenge, we've narrowed in. And so you can see the specifics in the rules. So we're really trying, both in the case of the Momentum Challenge and also through the partnership with CIHI, to be able to build on existing data collection mechanisms so that you can take advantage of the work that you've already done on that front. In the Momentum Challenge, if you have a look back at the slides on the timeline, you'll see that there are a series of webinars and other supports that are planned through the course of the challenge that will focus specifically on long-term success, scale, and sustainability, so that we focus on those questions that are most relevant now, because what we've heard from teams completing those collaboratives is great that we've done all this work. Now we really want to be able to make sure that we can continue the work and continue to grow it. So that will be the primary focus of the Momentum Challenge. So I hope that's helpful in terms of giving you a sense. If you do have other questions about the Momentum Challenge, feel free to contact the email address that was in the chat box, or you can also contact your regular contacts for the Quality Improvement Collaboratives. They're part of our team too, and they can make sure to get you the answers that you need. And with that, I should remind everyone that this session was recorded and will be available. So if you missed something along the way or you want to see the slides, those will be available. Or if you've got a friend who you want to twist their arm to participate in the challenge with you and help make change happen, you'll be able to share that as well. And there is a short survey that will be that is up now. If you're able to help us to continue to improve, we're a quality improvement organization, so we want to make sure that we are also learning from and with you about how we can do better and help to support you in this journey. Please do join with us in this journey to improving care for all Canadians. and join with all of our partners in this common goal. Thank you so much for participating on today's webinar, and look forward to seeing you as part of the challenge. Have a great rest of your day and a great weekend.
And this concludes today's webinar. We thank you for your participation. You may now disconnect.